Hi, Dr. Shraddha.
Hi.
Hope you're doing fine.
Yes, very well. Thank you very much for inviting me
Why,
here.
no problem. And please introduce yourself we all know you're a neurosurgeon, but what do you do? What does a neurosurgeon exactly do, please?
Okay, so yes, I'm a neurosurgeon. I'm founder and head of the department at Dr. R.N. Cooper Hospital and HBT
Okay.
Medical College in Juhu, Mumbai.
Okay.
And I'm very happy that somebody has asked me this question that, what is a neurosurgeon? You'd
Yeah.
be surprised to know that with less than 3,000 neurosurgeons in the entire country, this is a question which most don't have answer to. And even when we go and meet doctors, most of them are confused. Okay, neurosurgeon exactly
Right.
करता क्या है?
Right.
So I'm very happy and I'm glad that you asked me this question. Of course, the first thing that comes to your mind when you think of a neurosurgeon is, you feel that a neurosurgeon is somebody who operates upon the brain and its related ailments. Yes, we are the people who operate upon the brain, but there are a lot of other subspecialties that we cater to, which
Okay.
most of the people are unaware of. So some of them, quickly, I'll just put it down, are
Please
spine
do.
surgery. Uh,
Right.
yeah, spine surgery. I think most think that when you have hurt your back or a back-related issue, you have to go to a bone doctor or an
Yeah.
orthopedician. Well, they're not wrong entirely, but spine is a structure which is different from your rest of the bones because it is a structure which contains the entire bundle of your nerves, that is, the spinal cord. And of
Right.
course, the neurosurgeons are much better trained to handle those structures than other specialties.
Right.
So spine surgery forms a major chunk of other specialty that we deal with. Another one is interventional neuroradiology. I'm sure people who have had a family member suffering from stroke or
Yeah.
something of that sort have heard this terminology, neurointervention radiology. Okay,
Right.
so since it is related to the blood vessels and problems related to the blood vessels in the brain,
Yeah.
it is one another subspecialty that we carry out and we do intervention neuroradiology. Third, of course, is skull-base surgery. Again, a confusion between ENT surgeons and neurosurgeons.
Yeah.
So it is very much our domain, and this is something other than brain that we do deal with. Pediatric neurosurgery is another thing that we do. So, any
Right.
congenital problems of brain and spine in children is something that we deal with. And lastly is the peripheral nervous system. So we don't just deal with, nerves of of the brain and spine, but your nerves anywhere in the body. And if you
Yeah.
have a problem with that, we deal with it. So simple example, like if you have a carpal tunnel syndrome or if you have a
Hmm.
peripheral nerve tumor,
Right.
then that is something that we do cater to. So yeah,
Okay.
so this is the spectrum of a neurosurgeon.
Yeah, so in medicine, a lot of fields do overlap with other specialties also, and I think it's just natural for a medical practitioner to be referring the patient to the right specialty. But for that, we should at least know what the specialty does. So thank you for the brief on that, and of course, coming to the topic of today, that. The second lockdown coming, everybody is again work from home. People who are expecting to get back to work are again stuck to work from home for an indefinite period of time. We still do not know when we are going to join office like normal times before, but everybody has spoken about side effects of work from home on the bones, the muscles, all of those things. But I think we are first time talking about the effects of work from home on the brain and spine as specifics. So, do you want to introduce this? And why has this become really common? Do a lot of more patients come to you with these kind of complaints?
Uh, yeah, so I think with the pandemic setting in, there has been a 360-degree change in the lifestyle
Yeah.
that we are dealing with currently.
Right.
So the entire routine has got changed with work from home coming into the picture. And it definitely, one thing that it has done is taken out the discipline out of our lives.
Yeah.
So when you have office, you get up on time, you go to your gym on time, you are ready
Yeah.
on time. Everything is,
Yeah.
time bound, and you maintain a routine. So you're very disciplined, which is completely,
Yeah.
gone for a toss, considering that you're working from
No.
home and
Yeah.
you have that flexibility. So
Right.
that sudden change is there, and suddenly, we've gone digital. So from
Yeah.
work from homes to webinars to web series. So
Yeah.
everything is on the screen, and we've been forced to be glued to our couches and on our screens.
On screens. Right.
So obviously there is lethargy and lag that comes into play with all of these things. And the first thing to be affected is your brain and spine, because your way of dealing with things has completely come to a change.
Change. Right.
So, why these effects are happening? Let's just
Yeah.
go to the basics of things first. So, humans have been designed physically in such a way that you need to be socially and physically both active. So, our
Right.
bodies have been designed in such a way that we have to be physically active. Similarly, our brains have been designed in such a way that we need to have that social interaction, that one-on-one
Little
conversation with different
stimulation.
people.
Yeah. Yeah.
Yes.
Yeah.
So, which definitely both have been hampered during the lockdown. All of us do say, yeah, we are catching up on Zoom meetings and social
Yeah.
media and all of that. But it's not the same. We all know that it's not the
It's not.
same like meeting in
Yeah.
person and talking to something. So
Yeah.
this together, the first effects that we started seeing, and I think at your, normal homes also, most of y'all must be facing, especially our senior members of our family
Yeah.
who are actually more social than what we are. So
Yeah.
yeah, so
Their restlessness
I
kind of
think
comes out. Yeah. Their
yes,
need to go
and
down, meet their, yeah. Yeah.
so that's there, and I think a lot of y'all must have seen that they've started complaining that we are forgetting things. I
Yeah.
don't know, but at
Yeah.
we have been getting a lot of people who are saying that we have this memory loss happening.
Hmm.
We're not as
Okay.
memory is not as sharp as it used to be earlier on, and we forget small things.
Okay.
So
Right.
that is one big thing that is coming in with social media and work from home
Right.
culture coming into the picture. And it is sad that these patients are coming up and saying that forgetfulness is happening.
Yeah.
So this is one of the effects of isolations and social disconnect that we are
Yeah.
seeing nowadays.
I think it's the
Uh,
caging effect that people are not getting to go out, meet people. So they're not, the general brain stimulation that you get just by talking to a friend or colleague. Just a little thinking, talking out what you were thinking, what happened during the day, just telling somebody else about it also means, I mean, now
Absolutely,
it's
yeah,
underrated, but now when those things are not there, you actually know the value of those things.
yes. So that's how our memory system actually works. So our brains have been designed in such a way. So when we take breaks at work or even at home,
Yeah.
and we
Yeah.
narrate an incident or our routine to somebody who is along with us, that is captured as a memory in our brain.
Right.
And when you've
Yeah.
spoken to two, three people about the same thing, it stays on in your brains. So
Right.
yes, that is one of the major reasons why we are having memory loss that we see in these
Right.
patients.
Right.
And it is something that a lot of people are coming in and telling us that please do something about this.
Right.
The second most common problem that we've been seeing with more screen time is something that we call as computer vision syndrome. So when
Okay.
you're glued to your television or screens more than 10 to 11 hours in a day, uh, the first thing that gets affected is your eyes. Everybody knows
Okay.
that it
Yeah.
is
Yeah.
your screen that is responsible for this.
Right.
So strained eyes, dry eyes, blurred vision, and then eventually headaches, because
Right.
that's what it boils down to. Ultimately, everything is connected to your brain. So
Yeah.
once you have gone through so much of screen time and problems, what people come to us with is computer vision syndrome, and
Okay.
that is one thing that is presenting as headaches, and of course different forms of headaches. Migraine is the most common one,
Yeah.
which most of us
Yeah.
are aware. So
Yeah.
suddenly there is a splurge in the number of different kinds of headaches that are coming into play. Uh, and we are treating a lot of patients who are coming in now saying that headache is a chronic problem, and something needs to be done about that.
It's just there in
So
the back of their head. And this has been personally noted too. A lot of people we know around us do complain on that, but then that's, of course, taken lightly, I think. More than anything, people just treat it like it's there. It's just a part of life, and you are going to get headaches because screen time has increased. Dry eyes, personally, we've all, a number of people wearing specs nowadays has also increased. So you understand that, a lot of TV, a lot of computer, a lot of those things is causing those things. But
yes,
is there any
yeah.
home remedy that you suggest for these things?
So like I think a lot of it comes into play when you're working from home. So first and foremost is maintaining your computer at your vision height.
Yeah.
So when you're
Okay.
working from home, of course, the height of your eyes and the screen is definitely up and down. It's not never at par compared to workplaces.
Right.
So, that is something, then you're straining your eyes to look up or look down. So, the eye movements are affected, causing fatigue of your eyes.
Okay.
Secondly, the thing is that, a lot of people don't feel necessary to work in a well-lit room, or
Hmm.
you're just lazy to switch on the light in time, to
Hmm.
keep yourself in an
Yeah.
atmosphere that is bright. So again, something that makes your eyes strain more than normal. So when
Hmm.
you're working around, make sure that the room is well lit and you're working in a
Okay.
properly lit environment. And
Right.
thirdly is taking periodic breaks from your screen. What we suggest is at least every 30 minutes, you're supposed to, take a break from your screen.
Right.
Break from a screen does not mean that, you leave the screen and then you start reading something around you or something of
Right.
that sort. What essentially your eye needs is exercise. So, if you're working at home, we tell most of the people to, when you're taking these breaks, to look out of the window, to look at far distance objects, which
Okay.
exercises the internal muscles of your eyes and
Okay.
helps you to maintain the vision properly. Because when you're
Okay.
working at a fixed distance, your muscles are contracted in a particular position in the eye, and that contraction itself is the cause of pain and problems further on, the fatigue. Because
Right.
if you're overusing that muscle for such long hours, you can imagine how it works.
It's
So
yeah. Yeah.
that is one very simple thing that most of the people can do is take break, look out of your computer screen and look out of your window to as far
Okay.
away object as possible. So it's a very practical exercise that we have to be doing. And a lot of people also think that taking a break from work means going on to social media on the screen,
Oh yeah.
and
Yeah.
that's or
It's just
play
worsening
some
it
game or
maybe. Yeah.
something of,
Yeah.
yes. So you're worsening it not just for your eyes, but also emotionally, you're worsening it for
Okay.
yourself and everybody. Because it's a lot of studies have said that social media is as good as any other addiction. So when you
Yeah.
have a like or a hit on any post that you've put up, or something of that sort, it releases a feel-good hormone, dopamine, in our brains, and that's what you crave for. So
Right.
it's a feel-good hormone, but it emotionally it makes you very hollow. So you'd be surprised
Okay.
to know that the newer studies that are coming up are, wherein they have studied children who've been on social media or have been gamers and they have been, gaming onto computers. uh, they have found that they are emotionally more deprived and
Right.
their emotional content is very less. So,
Right.
yes, of course, this is one thing. Another problem that we are facing with this lockdown is sleep-related issues. So,
Yeah.
I think
There's no sleep
most
cycle
of
as such
the
for people. Yeah.
people, yeah, are
Yeah.
having difficulty going to sleep, difficulty in getting sound sleep, and difficulty, once you've gone to sleep, maintaining that sleep all throughout. So again, the screen is responsible for this thing, and most people have gotten into the habit of putting on the screen and going on to sleep at that time. And the light from the screens that we see is actually, it's your sleep promoting hormone that is there, melatonin. That secretion is
Yeah.
disturbed because of that light. So there
Right.
is a reason why we have a day and a night. The night there is no
Right.
light,
There's
which
no light,
helps in
right?
producing that hormone, and that's why you go off to sleep, and you need that thing to restructure your body, mind, everything.
Right.
So yes, screen, you have to switch off your screen at least half an hour before you're wanting to go off to sleep. So that is
Right.
one important thing that
Yeah.
everybody needs to understand. And it's easier said than done, but I think that is something that people need to work on.
If it's
And
essential,
yeah,
then I'm sure that
last,
people will.
yeah, and I think lastly, what everybody has managed to do is having some kind of a backache. Either the neck is
Because of
hurting
the
or the lower
posture,
back
I'm
is
sure. Yeah.
hurting,
Yeah. Yeah.
So that is, I think, another common problem that we are seeing, and a lot of people are complaining of this. So, yes, all screen, no play definitely has made Jack a dull boy, and the
Right.
effects are straight on the back. So, sedentary
Right.
life, couch lifestyle, weight gain, abnormal postures, both together very bad for your back. And that's why a lot of people, even with small routine home activities, they are tending to sprain their backs. Some people have also tried to lift up weights because help is not available nowadays. So, lift
Yeah.
up weights and then coming to us with problems of slip disc and,
Right.
issues like that.
Unmonitored exercising. Yeah.
Yeah, that is also another thing. And so back related issues are something that has suddenly just jumped in numbers.
So then what do you suggest? Like, we've all read that, you should have a table and chair set up separate for when you're working and not sleeping, lying down and working, not melting in your chair and working. Those things are there. Anything else that you would like to add about this?
So, like I said, your the screen has to be at the height of your eyes so that you're not
Right.
straining your neck or anything of that sort. When you're sitting, we also suggest that don't slouch in your chair. Sit back on your chair, and relax your back and sit. You need not slouch down or, stoop forwards or something of that sort. Thirdly is your hands. So most of us, when we are sitting at home, we don't have chairs with an armrest or something of that sort. So
Armrest,
that's
right.
why we are dangling down. But
Right.
there is a reason why office chairs have that armrest, because when you're working on the computer and you're typing with your hand, that help, that support to your elbow is essentially important to not strain your muscles on the back and
Right.
neck.
Right.
So if you could do that and keep your elbows, at a support, that definitely helps, whatever it is. And maintain a routine. That's most important.
Right.
So, if you were gymming or going for a jog or something, you have to continue that even when you're at
Right.
home. So, that's something.
Someone's asking if you can give some tips for kids.
Yeah,
Considering their
the thing is
schools are
that
online, I'm sure she's asking because of that.
yes, yes, yes. So, making them sit in front of the screen. And one thing is good that they just have to sit and listen. Most of
Yeah.
them, there's
No
very less
typing.
to
Yeah.
type and all of those things. So that's good
Hmm.
for them. But one thing that a lot of I have noticed a lot of people, just they want their kids to be busy. So then they ask them to be on social media or on, some games over the phone and things like that.
Right. Right.
Uh, Unfortunately, kids have suffered the most because of the lockdown. Their physical and social interaction has completely taken a toll. So, doing some activity at home along with them is important to keep them up and about and active and limit their screen time. You know,
Yeah.
uh, Generally we say to less than 4 hours, but of course with online schooling, we all of us know that it is less. So other things have to come down for kids.
Right. The other, yeah, the entertainment aspect,
Yeah.
yes.
Yes.
And then coming down, so right now everyone's talking about the vaccine and the relation with that too. A lot of people are getting blood clots and a lot of people are getting strokes. I'm sure there is an increase in cases with that also, with generally getting, corona and that related to having strokes. But also a lot of sense of smell and taste has been going. So is there a relation between that and the nerves, or is it just a symptom?
Okay, so a lot of so first we'll talk about the sense of smell and
Yeah.
taste that you're talking about. So it's not just in COVID-19 that we are seeing this thing. Even if you have a normal flu, or
Right.
if you have a running nose or some anything that causes cough and cold, your
Right.
sense of smell goes for a toss, and when your sense of smell goes for a toss, the taste automatically is affected.
Right.
The two
Right.
are interconnected, and so when you can't smell, your the taste also is not as normal as it would be. So,
Right.
of course, coronavirus is also one of the virus which causes, a running nose and cough are its symptoms. And the first things to be affected are the olfactory system, the nose.
Right.
But eventually, they do recover from this thing. So, the olfactory bundles that are affected by the virus are the reason why you have loss of smell. And it is
Okay.
probably one of the easiest way to recognize if you are
Right.
having
Yeah.
corona, because
Right.
many people tend to, and in fact, a lot of us have actually started smelling things now to just make sure
To
that we are not
check. Yeah.
catching COVID-19. Yes. So,
Right.
so yes, olfaction is one thing that is affected with coronavirus, like any other flu, but it is not something that is permanent. It might take longer than the other viruses to come back,
Right.
but definitely it is coming back. So
Okay.
I don't think that you need to worry so much about it.
Okay.
Secondly, is of course the incidents you said about vaccines and
Right.
the incidents of stroke and other clot-related issues that we are seeing with the vaccine. So, per se, coronavirus, when we were dealing with patients of COVID-19 who were coming into the hospital actively infected, there were a large number of people who presented with stroke. So, a lot of people, the presenting symptom was stroke, and when we did their tests, we realized that they are COVID
Then you
positive.
found they're positive. Right.
Yes. You know what we do, like intervention radiology in these patients, to remove the clot from the active stroke or stroke which has happened in the reach to us in a golden hour. When we tried to do that in these patients, it was not as effective. And the moment we would remove the clot, we have a window period wherein we wait and then we again inject and see if the blood circulation has been restored or no. Either the same vessel or something else would get clotted again. So
Okay.
the virus itself has some tendency to cause clotting, and this is something that we have seen when we have handled these cases of
Right.
COVID-19. Now, when we talk about vaccines, so the vaccines are supposed to replicate the effects of the virus, so that your body produces immunity accordingly, and
Antibodies.
then it
Right.
remembers it in the same way. Uh, Most of the vaccines, no vaccine has claimed that it is 100% effective. No vaccine has claimed that it has no side effects. So,
Right.
there are people who have been reported to have some kind of clot formation 72 hours after the vaccination has been done, and there has been issues like stroke and all in these patients. But the numbers are very less. So, if we see maybe in 1,000 people, uh, maybe one or two people have developed something
Okay.
like this,
Okay.
which can be, otherwise also, if they were at high risk and, something that had to happen. The exact correlation between the vaccine and this happening, we are still studying that, and I'm sure in a short time we will be out with a study regarding that also. So we'll know exactly whether it is the vaccine that is causing this thing or it is, some other process that was naturally going on and has given rise to something like that.
Right.
But because the numbers are less, and better than getting infected with the COVID-19 itself, we are telling everybody that yes, please go ahead and get yourself vaccinated.
Right. Yes. Okay, I think that was a good talk regarding it summed up everything regarding what's happening currently and what people need to look at. Do you have like a end note or take home message for any of our viewers?
Um, I think we have to stop behaving casually and start behaving responsibly. The
Right.
government has done a lot when the pandemic started itself. If they wouldn't have put down the lockdown at that time, probably the medical facilities that we are seeing right now, we were very far behind. We
Okay.
wouldn't have been able to cater. And the second wave has come in with a more deadly mutant strain, more problematic patients, and
Right.
uh, more number of people needing oxygen,
Right.
ventilators, and things like that. So the thing is that I think what these people need to understand that it's in our hands to be responsible and stop this thing. So whether it be your family member, it be your friends, it be your close relatives or anybody, don't take that chance. We've been saying the same things from the beginning: sanitize, masks,
Yeah.
social distancing, and it is high time that people do that. I know it's
Yeah.
very difficult. I know it's summer, it's
It's been a
crazy
long
hot.
time and everybody is just, I think, tired on the same routine of, but this is not the
Yes,
time to be, I'm sure.
yeah. So, I mean, if you are facing that difficulty in just wearing a mask, maybe when you
Yeah.
are out for 10 minutes or 20 minutes,
Yeah.
imagine the plight of us, the doctors who are working in these wards wearing the PPE
Yeah.
kit for six hours shift, our sisters, our
Yeah.
ward boys, our nurses, everybody. It's a request. Please don't
Yeah.
take these things lightly. Get
Right.
yourself vaccinated, that's important.
Yeah.
And please follow the norms. It's for your
Right.
safety more than anybody else.
Right.
So, yeah, about it.
We have two questions. We can quickly, I think, address them. One of them is somebody's asking about some history of heart attack. Can they take a vaccine? And somebody's asking the majority of clots are seen during the second dose of vaccine. Do you have any conclusions for the same?
Okay, so the only contraindication to the vaccine is, people who have had a history of big allergic reactions or
Okay.
anaphylaxis, if put it in medical
Right.
terms. So, if you have a heart attack which has been taken care of and you are on the medications of the same, you can please go ahead and take the vaccine. There is no
Hmm.
problem with, or there is no contraindication. All the centers know the mandate. They are going to monitor you and they are going to take care of you even after you've taken the vaccine.
Right.
Uh, the second question regarding the second dose of vaccination causing problems.
Hmm.
So, like I said earlier, also, what we are seeing within the first 72 hours of the first dose or second dose of vaccine, don't have a conclusive study to point out that yes, it is the vaccine causing these problems, and the numbers are very less. In fact, the first dose of vaccine, normal people are also developing some kind of reaction like a fever or chills or something of or body ache, something of that sort. In the second dose, most of the people are not even developing that reaction. So, having problems, I understand, related to clot formation do exist. Nobody is denying that. But until we have some conclusive evidence or conclusive study stating the same, it's
Right,
very difficult for us to just point out at the vaccine and say it's because of the vaccine. It might be mere coincidence and nothing else.
right, right. Okay. I think this session was extremely informative. Thank you so much, Dr. Shraddha, to take time out of the of your hectic schedule and give us some information and basic knowledge about the neurosurgery related things during the lockdown and the vaccine and the virus. Thank you so much. It was great to talk to you.
Thank you so much for inviting me. Thanks a lot.
Thank you. Thank you.